Hello everyone and welcome to AceOSCE's video for today. Thanks for joining me, Alicia, and today I'm going to be discussing a little overview or a brief overview of pharmaceutical ethics. I know this is a topic that most of us have discussed previously in some of the questions that I have posted on the group and even in some of the chats, or I've given a few classes to some of us on this topic as well. But I have realized over the course of time that IPGs or international pharmacy graduates do struggle with these ethics, especially when it comes to questions being asked or ethics cases per se. I wanted to have a brief overview about these so that people who are new to our group can actually revise them, and people who already know much about these ethics can maybe just revise their basics again. So let's go ahead and see a brief overview of ethics. So the Code of Ethics is a set of rules that most provincial pharmacy regulatory authorities have established. They do expect pharmacists and other healthcare professionals to follow these rules. These are ethical rules and these are not laws. So you do have to understand that these sometimes may prevail, sometimes may not be able to prevail depending upon what your scope of practice is or what the law would state in that specific scope. I will try to give you a little bit of an overview of what sort of questions you can get on these topics as well, and how important these are in terms of your OSCE evaluating and your MCQ exams. Now here, this is the document from the Ontario College of Pharmacists. This is the official document as of 2015. It has the 4 basic ethics. There are some other ethics that you can add on to these, but I wanted to have a quick review of at least the basic 4 ethics in this my video. So the first one that we're going to discuss today is beneficence. So everybody who's new here, just giving you a little brief overview. Beneficence is basically when the pharmacist does anything for the betterment of the patient. The patient's care is the first and foremost thing that we need to keep in our mind as healthcare professionals. So doing anything such as counseling, dispensing medications for the betterment of people does come under the ethic purview of beneficence. So say, for example, a patient comes in, he is asking you for an over-the-counter recommendation for his acidity. You assess him and give him a recommendation. What is the ethic you followed here? It is going to be beneficence. The second one is non-maleficence, or preventing any harm from happening to the patient. Now, this may be something that you will be discovering at every step or every second in your pharmacy, because you are having a lot of different procedures when you fill a prescription, right from data entry to clinical verification to therapeutic checks, just to make sure that therapeutically or technically the medication that is being given out to the patient is not going to harm them in terms of, for example, any medication errors, how you manage those errors, and just to make sure that there's nothing that the patient gets that's not supposed to go to him or is not in error given out to him. That would come in the purview of non-maleficence. For example, questions when there is a discrepancy in the medication that is given out, or there's a pharmacy error that happened, or it was something that the pharmacy gave out knowing that it can cause some sort of harm to the patient. For example, giving out sildenafil to a patient who's taking nitrate sprays for his angina would be not following non-maleficence. Again, it would be a very different sort of purview, because there may be some errors that can cause death, there may be some errors that can just cause side effects, and maybe some that don't cause anything at all. Regardless of what the consequence is, it is non-maleficence anyway. I know in most cases, if you are giving beneficence to a patient, you're also following non-maleficence because you're doing the betterment of the patient, therefore reducing future harm for the patient. Example, like giving the counseling for an acid medication, if it is beneficence plus non-maleficence in the sense that it is giving medication to the patient and reducing their chances of getting GERD or peptic ulcers in the future. So do make sure that you understand these ethics clearly. The third one is going to be respect for the patient or justice. This purview or this ethic is usually circumstances the fact that all our patients are equal regardless of gender, race, even say amount of money they have or how frequently they shop at our pharmacy. You do not have to give one patient preference over the other. So this is the purview of justice. Again, I want to emphasize on the fact that in some cases you may need to prioritize patient care for some patients over others. For example, if you are working in a busy pharmacy, you get 10 prescriptions in an hour. However, you see a patient who's having an anaphylactic shock in your pharmacy, you would definitely stop everything and go ahead and give him patient care by administering an EpiPen. So in those cases, there are exceptions for this specific ethic, which may exist. But in most cases, we do want to keep everybody in the same pile. You do not want to give one patient preference over the other, like I said, except for exceptions. The fourth one is accountability or Fidelity, which places the patient over the pharmaceutical business or the pharmacist's own motivations. So for example, if there is a patient who wants plan B, your religion does not allow you to give plan B, you need to be loyal to the patient and give them another address of another pharmacy or another place where they can have access to their medication, while you are not compromising on your own beliefs either. So you need to make sure that the patient is getting their care. You don't have to force yourself to be uncomfortable as a pharmacist. But as long as you keep the patient's interest in mind, that is the most important thing. Again, another example would be, you do not want to give Tylenol to a patient who doesn't need it just because you're getting money out of it, right? So like, you're a pharmacy owner, you get $10 for every Tylenol you sell, but the patient doesn't need it, so you don't have to prioritize those $10. You should be prioritizing the patient's care. So that is going to be the purview of loyalty. A lot of other ethics would probably be existing as well. For example, honesty, veracity, and autonomy. Those we can discuss later on. The question for today's topic is, on a Saturday night, Mr. Craig requests a 5-day early refill of lorazepam. The pharmacist notices frequent early refills lately, but none of the pharmacists discuss the issue with Mr. Craig. Mr. Craig explains that he's been taking more lately because he has difficulty sleeping and he only needs 10 tablets until he sees his physician next week. The pharmacist refuses to give him the 10 tablets and Mr. Craig starts shouting, "I need my medication now." The pharmacy manager overhears the conversation and comes to the counter and tells the staff pharmacist that he is a long-time customer, he's a VIP to us, please give him the medication. The first question based on this case is, what are the ethical values that are in conflict in this case? And number 2 would be, what ethical value did the other pharmacists violate when they did not discuss the early refills with the patient in the past? Let me know what you guys think the answer is in the comments below. I just want to make sure that you guys know what ethics play and how 2 different ethics can actually be played against each other. There can be 1,000 different questions that can come up from this case, and this is a common sighting in most community pharmacies, so being able to manage this and understand this case ethically is ultra important. I do wanted to quickly let you guys know that I am taking people in for my topic-wise classes. I still have a few slots left for my calculations and my professionalism classes, pharmacoeconomics, or even kinetics. So let me know whenever you guys want to come in, join our classes, or have any mini mocks with us for our EEs. For people who are preparing for their OSCEs, I am giving case-wise classes as well. So on your flexibility, I try to kind of make up cases for you, cases that I've actually seen in my own pharmacy, and I would probably be telling you what is the best way to approach that case, what are the other references you could use, what are the extra points you could use in your cases in order to make you stand out from the rest. Let me know. Also, the mini mock test is coming soon. I have part 3 of it already. That has gone out fast. I am trying to launch another one soon, so let me know if you guys want to be a part of this. As always, feel free to contact us on any of these platforms that I've listed on the screen here. I'm more than happy to answer your questions, and I hope that I can help you in your PEBC journey in whatever way I can. This was a very quick overview video about the ethics, but most of you already know it, and the new members, I hope this helped you out. Have a good one. See you there.